Here we are looking at the pair of ring-like meniscus on both the medial and lateral tibial condyles. In this picture, you're seeing a tear in the medial meniscus. I want to talk today about lateral meniscus tears as they're more associated with that iliotibial band and lateral knee. We can focus on the medial meniscus when we get to adductors. Okay. As it concerns meniscus, like any fibrocartilaginous pad, it is designed to absorb shock and reduce friction between two bony structures. The main reason that tears occur here, there's really two things you want to look at. One is just wear and tear over time. Like any cartilage, it can wear down. But traumatic injuries, and we'll talk more about what defines traumatic, can also be involved here. And some mechanics where you're going to see this come up is anything from squatting with poor biomechanics. Really, what you want to think about is twisting. Anything where there's twisting in the knee. So doing a squat with valgus collapse that's creating tibiofemoral rotation, or a poor pivoting motion during medicine ball throws, or a cut on a turf-like surface. Anything like that has the potential to injure the meniscus. It will often be accompanied with minimal to moderate swelling. So you'll get some swelling around the juncture between the tibia and the femur, and also a very sharp pain local to that area. Now, with the exception of the lateral medial horns, we really can't physically palpate these, so we depend on an orthopedic test called the Apoles grind test, which we will go over, which would help us to at least rule out meniscus damage. Things like bending the knee, being in a squatted position for a long period of time tend to elicit the symptoms involved with meniscus damage. Sometimes you'll notice with clients it's very hard to fully extend the knee, whether from the swelling or from the pain. They might also have like a locking or like a catching sensation they talk about, which could be associated with something like ITB syndrome, but we have to consider the possibility of meniscus damage. You would need an MRI to confirm a meniscus damage, so you would have to refer them out if you are suspicious. And they would have to orthoscopically go in and remove the parts of the meniscus that are sort of floating as debris inside the knee. And in some cases, they will have to do surgical procedures if there is a pretty severe tear in the meniscus.